So let us come to the final part, that is treating Kapha vataja sandhi shula. See, making this video on knee pain, I made it extremely, I made it sure that I am extremely simple and I am understandable to even the first year students of BAMS. Why? Because if you are successfully able to treat knee pain effectively, many patients are ready to give their half of the property to you, because that is the kind of amount of pain that they have to undergo for their knee in the old age. For a geriatric patient, not being able to walk or not having the chronic knee pain is the biggest headache for them, and any doctor who can cure them is God according to them. So when I talk about treatment, please do concentrate if you do not know about this treatment. So Kapha vataja sandhi shula, we have multiple treatment options, multiple kashayas that can cure this condition, but each kashaya is unique and to be used in a particular patient. Now we have Rasna Saptakam Kashayam to treat Rasna Dashamulam Kashayam, Varanadi Kashayam, Sahacharadi Kashayam, Gugulu Tikta Kashayam, Gugulu Tikta Ghritam, etc. But where to use all these conditions, I will tell one by one. Rasna Saptakam. Rasna Saptakam is Ushna Ruksha Mutrala, and it is excellent in reducing Kapha vata, and it is excellent in reducing pain instantly and swelling instantly. So Rasna Saptakam, whenever there is an acute pain and swelling, you can use Rasna Saptakam. Rasna Dashamulam, whenever there is acute pain and swelling but you need a little bala to the patient, then there is Dashamula in it. Rasna Dashamulam is Kashayam is nothing but Rasna Yerandadi plus Dashamulam. It is available in Vaidratnam company. So where you use Varanadi Kashayam, the patient is fat, the patient is having ama, the patient is having a lot of cholesterol, you seeing visible fat and the Dhatukata ama, both conditions you can use Varanadi Kashayam along with Kanchanara Guklu, etc. Sahacharadi Kashayam, very important Kashayam. Sahacharadi Kashayam is particularly used in the patient where they tell, sir, when I sit and I wake up, then pain is there. For such particular patient, you can mix Rasna Saptakam Kashayam plus Sahacharadi Kashayam. Sahacharadi Kashayam is specifically told for lower part of the body, is specifically told for knee pain, is specifically told for Adyavata, it is specifically told for Urustamba. It increases the blood supply to the particular part. Sahacharadi is a Sahacharadi is a first Kashayam that is told in Vata Vyadhi Prakarana. Giving Rasna Saptakam plus Sahacharadi Kashayam gave beautiful result in lot of knee pain cases of Kapha vataja origin. So you need to understand in detail what Sahacharadi. Sahacharadi is also Ushna Ruksha, and it gives, and it is Vatahara, and it is excellent in reducing knee pain and giving the blood supply to the particular part. So where you use Guglu Tikta Kashayam, Guglu Tikta Kashayam, Tiktakam Asti Vardhanam, Ushna Snigdam, Guglu Tikta Ghritam and Guglu Tikta Kashayam is used as is the Ayurvedic calcium. Tiktakam, Maha Tiktakam, Ghritam, etc. Guglu Tikta Ghritam is the Ayurvedic calcium. Tikta is Ayurvedic calcium. Tikta is Asti Vardhanam. So, particular case where you need to reduce the crepitus of joint, in that cases you prescribe Guglu Tikta Ghrita or Guglu Tikta Kashaya. I prefer Ghrita than Kashaya. So, there are different types of Gugulu. Which Gugulu you choose? When in doubt, there is a life hack. Always choose Kaisharu Gugulu. When in doubt, always choose Kaisharu Gugulu to the patient, because it is a middle path. It does not increase any doshas. So when there is Shofa, choose Gokshura Gugulu and Kanchanara Gugulu according to the condition of the patient. The patient is as little Pitta, choose Gokshura. The patient does not have Pitta, is pure Kapha, choose Kanchanara. Yogaraja Gugulu, Rasna Saptakam along with Yogaraja Gugulu you can choose, but I do not choose Yogaraja Gugulu because my desha, my place where I live in is Ushna, and Yogaraja creates a lot of Ushna to the patient, whereas patients living in Bangalore, Shimla, Ooty, wherever there is a cold condition excessively, they can use Yogaraja Gugulu and Maha Yogaraja Gugulu, which is equally effective as well. Usually in all the colleges it is told that Gugulu, first for Sandhivata you choose Yogaraja Gugulu. It's not like that. I find other Gugulus equally effective or much more effective than Yogaraja Gugulus. That being said, Yogaraja Gugulu is not less effective. It is used according to the condition of the patient. When the patient is having Ushnata, do not choose, please never choose Yogaraja Gugulu, Varanadi, Kanchanara Gugulu, etc. Always go Gokshara Gugulu, Kaishara Gugulu, like that if you suspect Pitta in a patient. But otherwise you can use Yogaraja Gugulu. It gives very good result if properly given in Kapha. So I always add calcium tablets. If I have Pravala Basmam, I give that is Astivardhanam, or the common calcium tablet I use are Riasto of Himalaya company or Albosa, any calcium tablet works fine. So coming to next, I told you these are all for removing the obstruction, removing the Kapha Vrita. But there is degeneration too. Other side of the dam, that is dry. So there, that other side of the dam needs water. So Brahmana Chikitsa also should be given with, along with the Kaphara Chikitsa. If you, so you have to choose Thailam capsules or Ghritam capsules. You have 3 Thailam capsules and Ghritam capsules that you can choose. You can either choose Gandha Thailam, you can either choose Dhanvantram 101 drops, or you can choose Sahacharadi 101 according to the condition of the patient. If the patient is feeling that the blood supply is less, you can choose Rasana Saptakam, Gokshara Gugulu, and then you can prescribe Sahacharadi 101. Sir, I sit down and then when I wake up having pain, the ideal prescription should be Rasana Saptakam plus and then Gokshara Gugulu and Sahacharadi 101. The patient is having crepitus more, then you choose Gandha Thailam. Their kadak sound is more like you on examination crepitus is more, their bone degeneration more, there you can choose Gandha Thailam. If you are in doubt, you can choose Dhanvantara 101, which is the middle path. Okay. And usually the prescription, after prescribing all this, I prescribe some Dhanvantaram Gulika or Anuloma Churnam for if the patient has Ajirna, I will choose Dhanvantaram Gulika. If the patient has constipation, I will choose Anuloma DS or something. So, ideal prescription contains 1 Kashaya, Rasana Saptakam Kashayam, Sahacharadi Kashayam, Rasana Dashambulam Kashayam, Varanadi Kashayam, Gugulu Tikta Kashaya or Grita. Choose according to the condition. Gugulu, Kaishara Gugulu, Gokshara Gugulu, Kanchana Gugulu, Yogaraja Gugulu. Choose according to the condition. Add any calcium if you want. Add Thailam capsule. Now, when adding Thailam capsule, you should be very sure that the patient does not have ama at the level of costa. If ask the patient to show their tongue, if it has coating, if it has white coating, please do not prescribe Thailam capsule or Ghritam capsule. If they do not have that, if they have little amount of Jirna, then only prescribe Gandha Thailam, then you can prescribe Sahacharadi 101 or then you can prescribe Dhanvantram 101, Thailam drops, etc.